Hi people, yeah, it's me again. I'm having some time to do this. After been being busy, quite busy, and it made me think of this subject, respect of elders and home care of elders, which is very important to me, subjects that's extremely important to me. It's hard to take care of elders, but at the same time, it's not that difficult. It's just very long and tedious as far as the long wait between med times and dinner times and stuff like that. Lunch, dinner, breakfast. But the thing is, what really gets me is hearing about and seeing and hearing about the disrespect of these elders, especially the ones that really deserve high respect, even if they've going through the dementia part. They still deserve a very high respect, and allow not to be condescending to them, to allow them as much independence as possibly can be for their situation, and still, don't treat them like children. It's the worst thing you can do, because these people, if you really have a heart and understanding, these people have put in their time. They deserve all the care and attention and love and devotion they can possibly get at this point in their lives. They don't deserve to be disrespected. They don't deserve to be condescended to. They don't deserve to be treated like they're retards or something, like, to put it bluntly, so they forget some things. So what? It's a part of life. It's a part of their journey, and they're supposed to be made, their last years, it's like they're on their way, and on their way out. So their last years are supposed to be made the most comfortable possible, the most pleasant possible, at the way they want. And that's another thing that really bothers me, is when they do home care, they often, I hear about complaints often about their routine, the elders' routine being so messed up, so taken out, like the reference point being taken away, reference points to be able, especially when they're going blind. And in this case, I won't mention names, but I won't name names, but I've been looking, I've known this woman. She's my mother-in-law. I've known her for 30 years. She's the one who took me to the Lord, who helped me take the last step in accepting the Lord Jesus with my faith. She's stubborn, and she's one of those really strong women all her life, and I've known her for at least 30 years of that. And I wouldn't dare treat her like a child. I would not dare be condescending to her. I owe her so much. She's been so helpful with me and her son all these years. She's always been there for us. We've been there for her, but she's always been there for us through thick and thin. So she is, and she's such a loving woman. She deserves all the respect possible, and all the care and love and devotion possible. Well, the thing is, I've been doing this for the last weekend, and I have to do another weekend, for most of the week, because nobody else can seem to fill in. But I would do it anyway. People like that is what I'm saying. She's an example of people that deserve high respect. She's just gone through an eye operation, and we're helping post-op meds, the eye drops and stuff like that, and to help her with her food and stuff like that, like what she normally does. We just do it for her partially, and let her do as much as possible on her own still, with a little guidance, but without taking her dignity away. And that's so important to not take an elder's dignity away, blind or not. And to have so much patience and to do things the way they want. It's not about you. When you look after an elder, when a younger person looks after an elder, it's not about the younger person, what they want, what's convenient for them. It's about the elder's wants and needs. It's about doing things for what they want. You don't change their points of reference to be able to get around. They know what stuff they have. They already know what stuff they have, where it is. If you change those things, it totally messes them up, especially if they're not seeing well. It messes them up, and it gets them upset. Because I don't blame them for being upset if their points of reference to get around their home, and we're talking about their own home, and she's still in her own home, and we're talking about looking after them while they're still in their own home for as long as possible. There are so many key points, and bedside manners. It's like you've got to have good bedside manners. So whether you have a personality for that or not, I happen to have that kind of personality. That I'm like Florence Nightingale kind of type when it comes to caring for other people that are needing that kind of care. But if you're not, you still are obligated. If you're going to look after your elders, you're still obligated to put on that, to be like that, and to make sure that you're not condescending to them while you're giving them their medicines or whatever, and you just, it's a thing that should happen. And I know there are some elders that seem like they don't deserve it, but they could be going through it's personal issues. And part of the dementia, if they start getting into dementia, will make them cranky, because they tend to forget things that they know that they should be remembering, and they think it's important things, but then you got to look at what's important for them to remember. If they start forgetting who you are, then okay, who the people are that are looking after them, they start forgetting family members, that's dementia. Before that, it's just normal forgetfulness, which everybody goes through anyway, as they age. But dementia I believe, from what I've experienced, dementia is not exactly the same as just old age forgetfulness. It's far beyond that, and not everybody gets affected by that. So you've got to look at it as an individual thing, and you've got to treat them right. Treat them with the same loving care you always did. Especially if you're a family member and you've known these, it's the best situation as a family member looking after. But if you have to start bringing in somebody for home care, you better check them out and make sure that they're going to be there, not just for the money, that they're going to be there because they love doing what they do, and they want a relationship with your elder, so that it becomes, a really close relationship of caregiver and the one who needs the care. That's a relationship in itself. That can be a relationship in itself, where the elder completely depends on the home caregiver, and because they completely depend on them, because they're in that situation, it should not be taken advantage of. It should be taken care of properly. So highly respectful, because they've done their time. Seriously, they have done their time. They put in what they need to put in life journey, in their own life journey adventure, and it's almost over, but not quite. And they probably still around because they've got some reason to be, but who knows? But the thing is, doesn't matter what faith, what culture, again, what belief. The basic thing is, socially, the basic thing is make sure you respect them. Make sure you don't treat them like children. Make sure you give them time to get themselves ready for medicine, especially medicine. You don't, like eye drops, you don't just drop them and that's it. You have to make absolutely sure they're ready, they're relaxed, they're ready, as it's coming, and the best thing to do is just to talk, joke around, you know. But then you laugh, you know, about the whole situation. I joke around. We have fun getting her medicines in, and we always, it's like we're becoming experts at this kind of thing. And it's that kind of attitude. If you've got a good humor attitude and compassion and love for the whole process while you're taking care of an elder, it makes it so much easier for them, and to truly care from the heart. True love, true pure love from the heart. You know, there's nothing like it, and it is rewarding. I'm finding it is rewarding to help her, because she's helped us so many times. So it's the same thing. If you've had somebody who's helped you so many years, and it's now time for you to reciprocate, do it gladly, because they deserve it. It's very rewarding to be able to give back to this woman. I love her to death. I mean, I just love her to bits. You know, I love her to bits. I'm going to miss her when she goes, but I'm going to have the confidence that she'll be out of pain and, you know, in a better place. But in the meanwhile, I'm appreciating the time I do have with her. So at the same time, so I'm just, it's basically, people respect your elders, and even the ones that seem to not deserve it, check it out, depending on what's been going on in that individual situation. But it's more likely they've forgotten some things from the past. They're not quite into the dementia yet, but most likely they've just forgotten some past situations, and just deal with it as it comes. But don't throw them to some strangers to look after, because that's going to be the worst thing. Be very, very careful. There's so many elders places that I hear about mistreatment, and I've seen mistreatment on the street of elders, and it really messes me up. Like, you know, it really upsets me. So basically, I'm going to leave it this. So I won't need a second part, I don't think. No. So respect your elders, and especially for home care, look after them, give them the respect they're due. Don't be condescending. Don't treat them like children. Don't treat them like they don't have a mind, you know, no mind at all left. Just work around their needs, and you'll figure it out. Just be gentle. Gentle care is extremely important. So, bless you, you know, blessings to all in Christ Jesus, always from my heart. And it's just an issue that I needed to mention or talk about, because I've had to deal with it a lot lately. And this is how I feel about it. It doesn't have to, I'm not trying to convince you to feel the same, but this is, I would think a lot of people would agree to this. I would think most people would agree about this kind of, you know, this issue. So, depending on the situations, but it's just your basic, you know, it's part of social interaction. It's taking care of your elders properly, as far as I'm concerned. But that's my belief. I won't force it on anybody. But I would think that there's still quite a few people out there that believe in proper respect for elders, proper care of elders. So let me know. If you don't believe the same, fine, but please express yourself properly. And like I said in my other videos, you know, proper interaction doesn't mean name-calling and nasty name-calling and all that stuff. You can respectfully express your opinion for interaction with me, but if you don't, I'm going to, you know, if you get nasty in that, I'll block you, or, you know, I'll block you from being able to come to my channel, so that other people that are nice and decent in expressing their opinion won't get bothered by you. So, it's simple. You know, be nice, express. It's possible to express, and I've seen it on here. I've seen it out in the world, and I've seen it on YouTube, that it is possible, even though there's a lot of bad stuff. It's still possible to interact without insulting each other and express a difference of opinion without insulting each other. It's completely possible. So that's what I'm asking for on my channel. I won't put up with much more. I won't put up with anything else. So take care, brothers and sisters in the faith, and take care of my subscribers. All of you, blessings. And we'll talk to you later, I guess. Bye-bye for now.